Dear colleagues, this case was referred to my clinic. Patient, 76 years old, with all signs of painful irreversible pulpitis in 2017. And you see the problem of this case. It's one of the breach, and second, obliterated canal. And of course, the question for clinician, if to refer firstly this case to CBCT scan or to start the treatment. And a very important fact that CBCT will not show us canal that their diameter less than file number 10. In my opinion, first step, we will start endodontic treatment, and just in case, if it will be impossible to find the canal, we will refer the patient to CBCT. And I did it. I start here the treatment, and it was a very challenging case. And firstly, in this obliterated pulp chamber, I started to look for the orifices, and it's very important to pay attention on color changes and look for the spots with different color. And inside of these spots, to try to find the sticky point with a very sharp DG16 instrument. And I did it, and I think I found the medial buccal orifice and distal buccal one. After that, I find firstly with DG16, I continue to work with thinner instrument, stainless steel, D11T, and I introduce it inside. After, in most of cases, I take the 0608 small 21 lengths K file and try to go inside. In this specific case, it was impossible, and I use additional approach. In first 2-3 millimeter, I try to work with the night eye instrument, with not just with a packing, small packing, but also with brushing motion to create some platform to look with and to try to go inside with small instrument. And I did it with 06 stainless steel file. In this specific case, I put it inside of the holder. It was much more easier from ergonomic point of view for me, and you can see that I was successful. Okay, it's very nice to show it during 1 minute on video, but in reality, it took about 40-45 minutes. But from this point, it's go easily. I go inside with 06, 08, 10, and already on 08, you can see this double curve. Today, if we see double curve, of course, it's a time for control memory wire instrument. Instrument that done from control memory wire night eye have no problem with multiple curvature, but they have a problem with torsional fatigue. It's important to understand here with obliterated canal, we have a huge amount of torsional fatigue for instruments. It's important to take multi-file system without skipping number, many irrigation, and in this specific case, I think a case to use HEDP with NOCL. Why? Because we have simultaneous chelation. Simultaneously, we will dissolve organic and inorganic part, and we will decrease accumulation of debris and decrease torsional fatigue. In this specific case, I choose a system named AMS, this control memory wire system, 10, 15, 20, 25, 30, with taper in most of files 04 or less. And I prepare this case. By the way, in cases with curved canal, I also use the night eye file also for working lengths determination X-ray. And you can see that it was a not so easy case also in palatal canal, and I tried to go deeply inside of the palatal canal, and here you can see the final result as a final obturation, same visit, with a combination technique using gutta percha points and epoxy sealer with macromolecule, BPM, with kind of thing. I hope this case was interesting for you. Have a nice time.